corticosteroids in biochemistry and effects on metabolism.
The problem of glucocorticoids in biochemistry. First, we have to give some questions. What happens in case of prolonged fasting or starvation? And what happens in case of severe stress or trauma? And what if there is prolonged cortisol therapy? Many questions that need answers, and these answers may be weight loss and wasting, hyperglycemia and even diabetes mellitus, bone pain and maybe fractures, and many other manifestations that may occur. This topic will cover a point about glucocorticoids and their biochemical points of view. As you know, glucocorticoids are a group of naturally occurring hormones produced in the body from the adrenal cortex and serve many functions, anabolic and catabolic. Of these hormones, cortisol produced from the adrenal cortex has catabolic functions when in excess and when administered to treat medical conditions, especially chronic disease conditions. Prolonged use of cortisol is associated in many cases with multiple problems due to effects at the genetic and biochemical levels. Of these problems, muscle wasting and other sequelae are problems that arise with prolonged use of cortisol as a drug. And in this discussion, some facts will be presented as a basis for the biochemical and genetic changes that occur with cortisol therapy and treatment. First, we have the problem of the negative nitrogen balance induced by cortisol. Cortisol is one of the glucocorticoids produced by the suprarenal gland or may be used therapeutically as a drug. And one of the examples of its effects in biochemical reactions in catabolism is the initiation of amino acid catabolism, as it has an action on some enzymes. One of these enzymes is a tryptophan dioxygenase enzyme. Tryptophan is an amino acid, and to be degraded, tryptophan needs an enzyme which is a tryptophan dioxygenase or tryptophan pyrrolase. This enzyme incorporates oxygen and opens the indole ring and forms N-formylkynurenine. And this is a process or starting process of amino acid tryptophan catabolism. This enzyme is an inducible enzyme in the liver by corticosteroids and also by tryptophan itself, and is inhibited by nicotinic acid derivatives including NAD phosphate. The process of catabolism of the amino acid tryptophan and some other amino acids will finally end in acetyl-CoA and glucogenic intermediate production. Also, glucocorticoids are important enhancers or inducers of the transport of amino acids to the liver, where they induce transamination reactions of amino acids, which serve as substrates for gluconeogenesis. So, as we know, that amino acid transamination gives the amino acid carbon skeleton, which serve as a substrates for gluconeogenesis. This action is produced by cortisol, but we have one of these glucocorticoids, which is testosterone, that is a stimulant of protein formation. So cortisol may lead to amino acid and protein catabolism, but testosterone produces the reverse effect. As an extension to the effect of cortisol on protein metabolism, protein loss may occur in case of infection and trauma, and maybe surgical operations where protein catabolism may be increased in response to the cytokines produced during inflammation and after surgical operations. And this cannot be compensated for by the muscle exercise, which is an inducer of protein synthesis. So, as a metabolic reaction to serve trauma, surgical operations, and burns, there is an increase in catabolism of tissue proteins in response to glucocorticoid hormones produced during these periods and also during periods of stress. And excessive production of cytokines during inflammations. This is important, or these cytokines are important during the utilization of threonine and cysteine for the synthesis of acute phase proteins. And maybe 6 or 7% of the total body protein may be lost over 10 days in case of prolonged bed rest after surgical operations or during infections and in periods of convalescence, which is a considerable amount of protein loss that may lead to atrophy of muscles. But this can be compensated for by muscle exercise, and this topic will be covered in detail later. The question now is, why does this occur? And we mean induction of transamination and production of the amino acid carbon skeletons. During periods of infection or surgical operations or prolonged bed rest, we have the glucocorticoids or the 11-oxysteroids secreted by the adrenal cortex, and also their sense is upregulated in adipose tissue. This is done for the purpose of increasing the process of gluconeogenesis. Gluconeogenesis means the production of new glucose molecules in the liver from non-carbohydrate sources, as there is some sort of prolonged fasting or starvation or even stress. So there is some sort of enhanced hepatic catabolism of amino acids due to induction of the aminotransferases, as well as tryptophan dioxygenase, which are induced by the glucocorticoid cortisol. Also, the glucocorticoids induce the enzymes for gluconeogenesis. These are important enzymes during periods of food deprivation to avoid the hypoglycemia produced during these periods. And in addition, glucocorticoids inhibit the utilization of glucose in extrahepatic tissues, so they may participate in the production of hyperglycemic states and may even be development of diabetes mellitus. And all these actions, glucocorticoids act in a manner antagonistic to insulin. So it aims at raising the blood glucose level by increasing gluconeogenesis and reducing peripheral utilization of glucose, and maybe also another mechanism that participates, which is the increase in insulin resistance. These effects are produced totally by decreasing the translocation of the GLUT4 receptors to cell membrane. This type of transporter or glucose transporter is important for the uptake of glucose and its delivery into cells, and this opposes the action of insulin in increasing the GLUT4 transporter and glucose uptake. So, glucocorticoids, and mainly cortisol, as we mentioned, are involved in gluconeogenesis by inducing all of the key enzymes involved in this process. And at the same time, cortisol induces enzymes involved in amino acid degradation and catabolism to provide the carbon skeletons which represent the substrates for the process of gluconeogenesis. An example, and is the first example for the gluconeogenesis enzymes induced, is the phosphoenolpyruvate carboxy kinase, which is a key enzyme in gluconeogenesis. This enzyme is regulated by several elements or hormones, and all of which act as a transcriptional level. And we are going to see how it is regulated. During periods of stress or food deprivation as prolonged starvation, liver glycogen reserves are depleted, and this will lead to steroid hormone production from suprarenal gland. The steroid hormone cortisol tries to maintain the blood glucose level by initiating the catabolism of amino acids as mentioned to provide the carbon skeleton for gluconeogenesis. And in the nucleus, cell nucleus, the complex of cortisol and its receptor, cortisol binds to receptors on the nuclear in the cytoplasm and passes to the nucleus, where it binds to the promoter regions of various key enzymes of gluconeogenesis, and this enhances the transcription of these genes. One of these genes is the phosphoenolpyruvate carboxy kinase gene, which is induced by the glucocorticoid response element when it binds to the cortisol and its receptor. And presented here is an illustration of the organization and the action of the phosphoenol pyruvate carboxygenase gene enhancer and the regulatory element glucocorticoid response element. Other control elements that are not shown in this figure include thyroxine receptor, cyclic AMP response element, which binds a transcription factor, cyclic AMP response element binding protein, and these are activated by cyclic AMP dependent protein kinase through protein kinase A through phosphorylation. And this is the mechanism by which glucagon works during the periods of fasting and prolonged starvation to induce the process of gluconeogenesis. As you know, glucagon, epinephrine, cortisol, thyroid hormone, and growth hormones are all important inducers and activators of the process of gluconeogenesis during periods of stress and growth. The phosphoenol pyruvate carboxygenase transcription, or the gene transcription, is inhibited by insulin, and this action is mediated by an insulin responsive element in the vicinity of the glucocorticoid response element. So the promoter of this gene has two areas, one for the induction and one for the inhibition of the process of gene transcription. Cortisol, glucagon, and thyroxine induce the phosphoenol pyruvate carboxygenase, while insulin inhibits its induction. Also, glucocorticoids were found to induce insulin resistance and thereby participate in the elevation of blood glucose levels. A second point, or a third point, for the glucocorticoids is their effect on lipid metabolism. Glucocorticoids promote lipid degradation on the process of lipolysis via the sense of the hormone sensitive lipase protein by a cyclic AMP independent pathway as shown in the figure, and this effect is inhibited by insulin and also by promoting transcription of genes involved in the cyclic AMP signal transduction cascade. Insulin and thyroid hormone were found also to increase hydroxymethylglutarate coenzyme A reductase activity, an enzyme which regulates the process of cholesterol biosynthesis, whereas glucagon and glucocorticoids decrease it, and this affects the sense of cholesterol. Also, bile acid synthesis is regulated at the cytochrome B7A1, which is a rate limiting step, and this is enhanced by cholesterol and regulated by thyroid hormone and glucocorticoids. And this will also be discussed in detail later. The last point to be discussed in this lecture is the effect of glucocorticoids and especially cortisol on bone metabolism. Glucocorticoids lead to a reduction in bone mass by direct effects on bone formation and resorption, which are the processes that regulate the bone tissue homeostasis. So this reduction is due to an imbalance between the osteoclast and osteoclast numbers. Osteoclasts are the bone forming cells, and the osteoclasts are the bone degrading or bone resorbing cells. And indirectly by suppression of the pituitary gonadal axis. Also, cortisol or glucocorticoids have effects on intestinal calcium absorption, renal tubular calcium absorption, and may be responsible for secondary hyperparathyroidism. And the effects of prolonged oral corticosteroids may lead to osteoporosis and increase the risk of fractures in patients on cortisol therapy for long periods. And as you know from the figure, we have the two main cells in bone, the osteoclasts and osteoblasts, which are regulated by many factors, and of which, of course, the cytokines and interleukins, and one of these regulators is a glucocorticoid. So, as we mentioned, glucocorticoid administration induces an imbalance in osteoblast and osteoclast numbers with loss of the bone mineral density. And whereas excess glucocorticoids reduce both osteoclast and osteoblast precursors, glucocorticoids promote osteoclast lifespan without affecting their number, and this will sequentially lead to increased bone turnover. And this is going to be discussed in detail later.
If you like this lecture, please hit the subscribe button and give your feedback in comments. The link for this lecture will be in the description below this video, and you can find other details in the website provided.